I think I want to invite Dr. Amoth to speak to all these issues.
Thank you, Waziri. I think you have spoken very well about the issue of the masks. And this is just an additional measure that we are undertaking in order to ensure protection of the public. But that notwithstanding, of course, we'll still continue to harp on the need for infection prevention control measures like the hand washing, the use of the sanitizers, and of course, the social distancing. The masks that we have distributed to you people, the media, is a 3-layered mask basically. And this is where we want to start local manufacturing. The outer layer is made of a material that is water repellent, also called hydrophobic. So if there's any spillage of blood or secretions, then it does not come into contact with you. If you cut the mask, a cross-section of the mask, there's a middle layer that has a filter. That filter is supposed to be able to pick particulate matter and bacteria and therefore stop you from inhaling the particulate matter or the bacteria. Then the third layer, inner layer, is the layer that absorbs, maybe if you are sweating or any secretions or any spit from you to the person maybe you are taking care of or the person you are talking to. So this is an additional measure that we have decided to deploy, especially in public facilities like the matatus, and also any other person who can be able to lay his or her hands on a mask. If you are in a public place, there is no harm in using one. In terms of the body of the deceased patient at Aga Khan University Hospital, we are in discussion with the family. The body, we have done disinfection, we have body bags, and as soon as they're able to clear with the hospital in terms of the bills, and also in consultation with our health team in Trans Nzoia County, we shall be able to dispose of the body appropriately. The second case, the second deceased person who died in Mombasa, actually plans are underway to ensure that the burial is done today. We have developed guidelines further to be able to help the healthcare workers and members of the family, and also in liaison with the directive that was given earlier by Waziri and the National Emergency Response Committee, that funerals will only be attended by close family members of 15 or less during the burial process. I think that answers the question. There is already local transmission in the country.
In the country, what are we looking at?
We are having pockets or clusters of transmission from various counties. We have, out of the 100 plus cases, about 30 or 40 are cases of local transmission with no history of travel, some of them no history of direct contact with anybody having a COVID-19 disease. So we are actually in the era of local transmission. Tosha.